Right now in Japan, a huge debate is brewing over a question that sounds simple but has massive consequences. Should your insurance pay for a common cold remedy? The answer could completely reshape the future of the country's public health system. And the reason this is such a high stakes argument, well, it all comes down to one absolutely staggering number: 45 trillion yen. To put that in perspective, that's around 300 billion US dollars. That is the yearly cost of Japan's national medical care. And a number that big is forcing some really, really tough conversations. And one of those conversations is zeroing in on a very specific kind of medicine. So, what are we actually talking about here? Well, they're called OTC-like drugs. Put simply, these are prescription meds that have the exact same active ingredients as the pain relievers or cold medicines you can just walk into a pharmacy and buy yourself. And that simple fact is what this entire debate hinges on. So here's how we're going to break this all down. We'll look at the proposal itself, we'll hear the arguments for saying yes, and the arguments for saying no. Then we're going to put them head to head to see where they really clash. And finally, we'll look at how this particular debate played out and what bigger question it leaves us all with. Okay, first up, the proposal. This was put forward by the Japan Innovation Party. And on the surface, the idea is pretty straightforward. Let's just stop covering these common OTC-like drugs with public health insurance. But as you can guess, that simple idea leads to a very complicated question. So here it is. Should these everyday medicines be something we all just pay for out of pocket? Or does everyone have a right to get them covered by insurance after they've seen a doctor? As you're about to see, there are two very compelling and totally different answers to that question. Let's start with the yes side. For them, this argument isn't just about saving a bit of cash, it's about making the entire healthcare system sustainable for generations to come. And this quote really gets to the heart of their philosophy. It's all about concentration and choice. They're looking at that 45 trillion yen bill and saying, look, we have to focus our resources where they are needed most desperately. So their case really boils down to a few key points. On the economic side, they point to an estimated 350 billion yen in savings every year. From a practical standpoint, it frees up doctors to focus on more complex, serious cases. And behaviorally, they argue it encourages people to take more responsibility for their own minor health issues. Now, to make sure this is fair, they've also proposed a safety net, a kind of voucher system to help out low-income individuals. But, as you can imagine, the other side sees this completely differently. For them, this isn't about economics at all. They see it as a fundamental risk to public health and to the idea of equal access to care for everybody. This quote just sums up their argument perfectly. They look at this proposal and see something that could create dangerous gaps in the healthcare system, hurting the people who are already the most vulnerable. And their concerns are pretty profound. They warn that what seems like a simple cold could actually be masking a much more serious illness, a diagnosis that gets missed if people decide to skip the doctor to save money. They highlight the huge burden on patients, whose costs for these drugs could double or even triple. And that whole 350 billion yen in savings, they say that's a fantasy that completely ignores the massive future costs of treating diseases that weren't caught early enough. Okay, so we've heard both arguments. Now let's really get to the heart of it and see exactly where these two worldviews collide. First up, the money. The yes camp sees clear, direct savings, 350 billion yen, that will help keep the whole system afloat. But the no camp fires right back, saying that number is just a guess, and a bad one at that, because it ignores all the hidden, long-term costs that will pop up from delayed treatments. Then, what about patient safety? The yes side paints a picture of an empowered future where people use apps and talk to pharmacists to manage their own minor issues. The no side says, hold on, that's just not realistic. Not everyone is tech savvy, and let's be honest, a busy pharmacist is no substitute for a real doctor's diagnosis. And finally, the big picture, the future of the system itself. The yes side sees this as a careful, necessary fix, a limited change to save the whole thing from collapsing. But the no side? They see this as the first step down a very slippery slope, where insurance coverage starts getting cut for more and more serious conditions down the line. So after all that back and forth, where did the debate and our source material actually land? And more importantly, what's the fundamental question that this entire issue really forces us to think about? So how did it end? Well, in the debate our sources covered, the victory actually went to the no side. The judges ultimately felt that the risks of the plan, especially without much stronger safety nets in place, were just too big. But here's the thing. That verdict only settles one debate. It doesn't actually solve the fundamental problem.
Because it leaves us with this core dilemma. What is the ultimate goal of public health insurance? Is it supposed to be a universal safety net that catches everyone for every single ailment, big or small? Or, when resources are limited, does it have to evolve to prioritize only the most critical needs just to make sure the whole system can survive? That, right there, is the real 45 trillion yen question.